Hey, it's Dr. Scott Darling with Darling Hair Restoration, Liberty, Missouri. We're going to go over some common conditions here today that we see in clinic that people seem to talk about the most. So we're going to begin here.
Well, Doc, I was reading there are 8 major reasons for hair loss. I was going through this article and it was talking about genetics, intense stress, hairstyles, dandruff, inflamed follicles, hormones, and autoimmune diseases. If we can talk 3 or 4 of those today, maybe you can do another video on the rest of them later. I know you're a busy man. Can you talk to me about genetics and what genetics play as far as a role in hair loss?
Sure. So hair loss is typically inherited. There are other less common features for hair loss, but the number one cause for hair loss that we see are genetics. For men, hair loss starts in the front and typically recedes back, whereas women have a kind of a widening of the part. So what happens is men and women both make testosterone. Testosterone gets converted to DHT, dihydrotestosterone, by an enzyme called aromatase, which lives on the surface of the hair follicle. And if the hair follicles, if they're genetically susceptible to DHT, then they're going to eventually start miniaturizing and then go dormant and then permanently scar in. At that point, you're headed for a hair transplant. If we can stabilize your hairline before that, we can try to treat you medically. And then sometimes it's a combination of therapy where we do both medical and hair transplantation both.
What role does intense stress play in hair loss for your everyday American?
So intense hair stress can make an active hair follicle go dormant. And when they go dormant, they can go dormant up to 6 months, sometimes as long as 9 months. But intense stress would be like a COVID infection, hospitalization, car wreck, could be a life event like a divorce. But these factors can cause the hair follicle to go dormant, and that would entail thinning and shedding.
What role does hairstyles play in hair loss?
Hairstyles can affect the hair follicle. If there's intense stress on the hair follicle through the way you style your hair, then that will cause their hair follicle to go dormant, and eventually if the stress doesn't stop, it's going to permanently scar in, and then you're headed for hair transplantation.
Do hormones play a large role in hair loss?
Hormones, there's specific groups with hormonal issues. There's women with polycystic ovarian syndrome and other diseases that results in increased androgens. Androgens have an effect on the hair follicle. They make it miniaturize and eventually permanently scar in. So when you see me, you're getting the medical expertise to diagnose and treat secondary medical cause for your hair loss, including hormonal imbalance.
What are the different types of treatments that you offer to correct hair loss?
Hair loss treatments are non-medical and medical as well as surgical. This is highly individualized. There's a whole menu of items that we can offer you for your particular stage of hair loss. It's just a matter of coming into clinic and we discuss these and lay them out. Some people want non-drug therapy. Other people are accepting of drug therapy. And other people wish to undergo surgical hair restoration. So there's a whole slew of options here, and it's exciting that we can really impact your hair loss.
When people come into Darling Hair Restoration to see you, are they going to see you, or do you have PAs or nurses that they're going to end up seeing?
So when you come to Darling Hair Restoration, you're going to see me. That's kind of the separator between us and other clinics. You're not going to see a sales agent. You're not going to see an assistant. You're going to see the physician. I've been in private practice here since 1999. That's 25 years experience. So when I'm looking at your scalp, I'm making sure there's not a secondary medical cause for your hair loss, and that whatever we do is going to lead to increased hair density. So you won't have any setbacks because I'm going to talk to you in depth about where you're at and what we need to do.
And what's your experience in training as far as hair loss or hair restoration goes?
So I've got a background in dermatology provider for insurance, commercial insurance for 25 years, and have seen a lot of hair loss conditions at this time, and very effective in diagnosing and treating these.
Did you work at other hair loss clinics before opening your own practice?
I've spent time with other hair restoration surgeons and have done significant training through the International Society of Hair Restoration Surgery. So have done a tremendous amount of educational background and experience and training in hair loss conditions.
So do you welcome all people from all walks of life coming into your clinic?
Yep, we treat all age ranges. We treat people in their teenage years, their 20s, their midlife years, 40s and 50s, and people in their 70s and 80s.
Is there financing available for people that want to do a hair transplant or a hair restoration procedure with you?
For those people that need it, there is financing available for hair restoration procedures, yes.
Doc, what kind of advice would you give to your first step people who are experiencing the hair loss and they're not sure quite what avenue they need to take?
So if your hair loss condition doesn't stabilize in 6 months, then you need to come in and have a consultation done with us.
So what number would they need to call in order to schedule an appointment with you?
So the clinic number is 816-792-3400. Be glad to schedule an appointment. We'll spend at least 30 minutes with you, if not longer, and we'll go over where you're at in your hair loss journey.
Is there any way to contact the clinic off of your website?
There's a contact page on the website. You can contact us by web, and we'll get back with you either by email or we'll call you directly.
How long is the wait to get an appointment or a consultation with you for hair loss?
The wait can be, usually it's a few weeks. Glenda will be glad to make an appointment and get you in as soon as we can.
Outstanding, Doc. I greatly appreciate your time today.
Thank
And
you.
I look forward to having another discussion with you about further causes of hair loss or hair restoration.
You bet. Thank you.